The landscape of weight loss has been transformed by the emergence of injectable medications, sparking both intrigue and debate among healthcare professionals and the public alike. And here to give us more insight on the safety and effectiveness of these weight loss medications is Dr. Simran Sethi from RenewMD. Dr. Sethi, it's always great to have you here on Live in the Bay.
Thank you, Jessica.
We're usually talking about skincare, but I'm so happy that we are talking about these weight loss injectable medications because clearly we've heard so much about them. So for anyone that doesn't know, give me an overall view of what these are and why they're so popular now.
Yeah, so I'm an internal medicine physician by training, and I have done and still do medically supervised weight loss programs. So yes, there's a lot of interest in weight loss with injectable medications. A lot of people know the term Ozempic, semaglutide. So now we have in the market excellent medications for weight loss that are injectables. They were initially developed for diabetes, but over time found to be effective at reducing appetite and causing fat loss. Now they're more available, but again, just like anything, when there's a lot of hype, there's also a lot of misinformation and misuse. So today I wanted to address some of that because it is effective and safe if done correctly.
Yeah, and that's kind of exactly what I wanted to get into with all the hype about these medications. When is it safe and who is this good for?
So when it comes to the weight loss medications, there are two that are the most popular, of course, and very effective as well. One is a medication called semaglutide, which is the generic form of Ozempic, Wegovy, and the other one is tirzepatide, which is the generic of Mounjaro, Zepbound. And after very large studies with thousands and thousands of patients, it's become clear that tirzepatide, so not Ozempic, not Wegovy, but tirzepatide, which is the generic of Mounjaro, Zepbound, is the gold standard for weight loss because it is an excellent, effective way of losing weight for anyone with a BMI of 27 or greater. Now, that is not always the case. You know, anyone who comes to my clinic and says that, you know, I'm usually around these many pounds, and that they're in a range where they would be considered healthy, but now they're over that weight, you know, I stick to that versus exact BMI calculations.
Okay, so I know exactly. It's kind of, you know, a lot of people are just thinking, oh, this is the easy thing that I can do. But are there some safety things that they need to keep in mind while they're on this medication? Do they need to be doing things in addition to the medication to really get on track and stay on track?
Yes, exactly. Well, yeah, just like anything, right? It's never that easy. And you can safely be on these medications, but you cannot lose more. You know, you should be at a steady rate of weight loss so that you don't lose a lot of muscle mass, which is something that semaglutide was causing a lot of. Tirzepatide, on the other hand, does not. You also need to be supervised to make sure that your weight loss is happening in a healthy way. Take this time as you're losing about 1 to 2 pounds a week to instill some great lifestyle habits. Increase exercise, focus on strength training instead of cardio, start eating more protein, clean protein, and so forth. So yes, there are a lot of other things that go into that journey.
A lot of celebrities, of course, have come out and spoke about using this. How do you think that that affects kind of just the general population in hearing the celebrities talk about this? Is this a good thing or a bad thing?
You know, I think there's both good and bad. And I think the fact that they're doing it introduces the idea to people. But I also think that sometimes it can create a lot of misinformation and misuse. So I know that a lot of these medications are available online. You know, a pharmacy ships them to you and you just inject yourself, but there's no one to really monitor what you're doing, and there have been incidences of people overdosing. And there are some celebrities who maybe are misusing it or not using it optimally. So I think there's a good and bad to it, but in general, just like any weight loss journey, doing it steadily and taking the time to instill good lifestyle habits that make this sustainable is important.
Yeah, you just mentioned, you know, being able to order it from an online pharmacy and then than injecting yourself at home. Why do you feel it's more important to go to a doctor's office, a physician's office, to have it administered there and kind of work with your doctor to make sure that you're doing it safely?
Well, because, you know, weight loss is, it's complex. Everyone is going to have different side effects. They're going to have a very different, they're going to have a very different path and journey. And they need guidance. And the goal should be to lose weight successfully, instill great habits, and then get off these medications, which requires tapering the medication dose. It requires having a conversation with the patient, see what they're actually struggling with. Is it really calorie deficit? Are they getting fatigued because of that calorie deficit? They should be able to function normally. So all those things happen with conversations, with visits, and some people require some accountability. So, and those are not things you can get on the internet.
Yeah, so which one do you offer in your office?
I've only stuck to offering tirzepatide because it is an excellent drug. It's been so well studied. It's safe, and also more effective than its sister, semaglutide.
For anyone that's watching this and is curious, where can they get more information? What is the process in getting set up to kind of learn more about it?
Yeah, so you know, you can get more information on my website, RenewMDWellness.com. And in general, we start with a consultation and in which I determine whether the person is a good candidate, so for dosing, and then we give you the option of coming in weekly or monthly.
Yeah, amazing. I mean, me personally, I'm so afraid to inject myself at home. So I think going a route of, you know, never doing that for myself if I needed anything, you just always know it's so much safer when you're in the doctor's office and you have that personal care. So thank you so much for sharing about this. This is such a hot topic, and I love just hearing a little bit more of the facts and fiction based on all of these medications. So I appreciate it.
Thank you.
If you want to learn more information about any of Dr. Sethi's tips or treatments, you could head over to her website at RenewMDWellness.com.